World Health Day is observed annually on 7th April to highlight pressing global health issues and mobilize actions to improve public health outcomes. This year's theme, Together for Health, Stand with Science, emphasizes the critical role of scientific collaboration and evidence-based action to improve health outcomes. In Nigeria, the dual burden of infectious diseases and rising non-communicable diseases, NCDs, including malaria, lower respiratory infections, HIV/AIDS, neonatal disorders, and high rates of tuberculosis, diarrhea, and meningitis make the need for scientific approach necessary to mitigate these health challenges. This has rapidly transformed the Nigerian healthcare system through scientific programs such as mRNA vaccine training, AI-driven diagnostics, and molecular research targeting diseases like cancer and malaria. Also, key initiatives focus on domesticating research, utilizing biodiversity for medicine, and upgrading diagnostic infrastructure to reduce reliance on foreign medical facilities. Although the impact of these approaches is still yet to be profoundly evident due to significant challenges such as inadequate financing, infrastructure, and brain drain in the health sector, there is a clear-cut pathway to take towards achieving sustainable scientific approaches towards wholesome public health with few professionals moving towards it. On Panorama today, we will take a look at the scientific approaches readily available and the ones we need to have for public health, even in our primary health centers. You can follow this news broadcast live on our website at nta.ng/live and on our other social media handles displayed right on the screen. I'm Awal Yusuf Jibo. Thank you for joining us on Panorama. First, the news. The second edition of National Police Day holds today at Eagle Square, Abuja, an initiative introduced by President Bola Ahmed Tinubu to honor the sacrifices of police officers and strengthen public confidence in policing. Beyond the colorful parades and display of operational assets, the day serves as a reminder of the critical role the Nigeria Police Force plays in safeguarding lives and property. It also provides an opportunity to reflect on ongoing reforms aimed at enhancing professionalism, accountability, and community engagement within the force. Away from that, Governor of Enugu State, Dr. Peter Mba, has commended operatives of the Department of State Services, DSS, for the arrest of high-profile kidnappers and gun runners in the state. He gave the commendation during a visit to the agency's state headquarters on April 5th in Enugu. The governor expressed particular delight over the arrest of a high-target gang leader who has been responsible for a series of attacks on security operatives and kidnapping for ransom in Enugu and its environs, noting that residents will finally be relieved of his reign of terror in the state and southeast region. He further expressed dismay at how able-bodied individuals could abandon human decency for heinous crimes, stressing that the full weight of the law awaits the criminals. He praised the DSS for their professionalism, discipline, while urging the command to maintain this momentum, which he described as the core duty of government. The governor, on behalf of the people of Enugu State, expresses his gratitude for the peaceful atmosphere brought about through the efforts of the service and other security agencies in the state, expressing confidence that the criminals will finally end up behind bars with their network already disrupted. He added that duty to sustain the tempo of security services delivery must remain the primary essence of government and can never be taken for granted. Governor Mba expressed hope that the state would be rid of criminals with the sustained efforts of security agencies and reaffirmed his commitment to making Enugu the safest hub for tourism, business, and living. To build effective symbiotic relationship with the newly inaugurated cargo airport when it resumes activities of cargo and international flight in Iperu-Remo, Ogun State, the Nigeria Customs Service has equally unveiled its Operations Unit Zonal Office close to the airport. Unveiled by President Bola Tinubu, The nation's Customs Service expresses conviction that the facility will not only boost its expansion process, but boost revenue generation. Larry Belay has more on this.
Situated close to the new cargo airport in Panorama, Ogun State, the Federal Operations Unit, Zone A office of the Nigerian Customs Service, unveiled by the President, Bola Tinubu, is a demonstration of the customs readiness to increase expansion and reform initiatives.
Federal Operations Commission.
The Controller General, Nigerian Customs Service, Adewale Adeni, while expressing gratitude to Ogun State government for the support, added that the development was driven by the need to deliver their core mandate of revenue generation and trade facilitation.
We got the land, over 50 hectares, that we are using for this. So they will be moving here as soon as possible. It's already been furnished. It is in fulfillment of our mandates. Our operations are increasing, and we needed more space that is comfortable and that's convenient for all of us.
The expansive project site is to accommodate 142 buildings, which include a training college, multi-purpose halls, and sports complex. The Customs Service believes the project will help with the increasing demand at the existing facilities in Ikeja, Lagos State. Larry Belay, NTA News.
In other news, Cross River State Governor Basi Otu is calling for the review of the state's hydrocarbon status, urging unity, support and patriotism among the people of the state, irrespective of political affiliations, in order to reclaim her oil wells. The governor also highlights his administration's achievements in infrastructure, agriculture, education, tourism and security. Justina Etim reports that this was during a briefing of leaders and elders of the state on the position of the disputed oil wells.
A federal report confirms Cross River State has over 100 producing oil wells, affirming its coastal status. Briefing the people on the developments surrounding the disputed oil wells, Governor Otu warns that exclusion poses security and economic risk as foreign actors now exploit new wells.
The hallmarks of President Tinubu's approach to nation building and national interest supports our cause. Verifications, constitutionality, and government interagency interventions have brought clarity to the dispute. Of course, with efficient resolving dialogue and negotiation capabilities of our brilliant brains and strategies, we expect a favorable verdict at the end of the day, bearing internal wranglings and mischief from our people. This is where today's meeting gains significance. Our state rights must be recognized and protected against unfair treatment. Our past sacrifices for national unity must be recognized.
Former Speaker, Cross River State's House of Assembly, John Gold-Label, says the Supreme Court didn't transfer 76 wells to Akwa Ibom State.
In 2005, there was another case which dealt with the maritime area of the Dupari area. But Justice Edozie said, since Nigeria has not yet demarcated the maritime boundary between Cross River and Akwa Ibom up to the ceded part of Bakassi, I cannot deliver this judgment. The only difference is that Akwa Ibom was already enjoying those oil wells. We wanted to take it from them. Because this judgment was not given, we didn't get the oil well. They concluded that the court gave them the oil wells.
The Surveyor General of Cross River State seeks fairness, citing economic losses from what he describes as flawed judgments.
The main aim and purpose is to go and undo that irregularities, injustice.
With the state poised to reclaim its rightful place among oil-producing regions, calls intensify to resolve the oil well dispute. In Calabar, Justina Etam, NTA News.
Let's pause for a break. Panorama will be back. Welcome back. Health, the absence of disease and a state of complete physical, mental and social well-being is priceless. That is why medical experts are highlighting the importance of promoting good health by protecting the ecosystem and embracing scientific integrity. Hingino John Adams reports.
Global Health Spotlight is now focusing on the One Health approach, which recognizes a fundamental truth. Human health is inseparably linked to that of animals, plants, and the environment they all share. So, protecting the ecosystem is non-negotiable, and central to this is the role of science. Professionals are calling on global leaders to leverage the power of scientific collaboration and evidence-based guidance. They believe this is the only way to tackle emerging health threats, from the rising cases of chronic diseases to the devastating impact of climate change on general well-being.
Telemedicine in particular has actually helped in taking the practice of medicine to rural areas, where a lot of people don't have the capacity to visit towns or areas where more efficient healthcare services are available.
Now we rely on scientific guidelines, we rely on research-backed protocols, we rely on better diagnostic tools, right? So for example, in pain management, we now understand things like chronic pain. We understand nerve involvement and how that everything is not musculoskeletal. We understand so much, right? So treatment becomes more targeted, more precise.
Experts believe to secure a healthier future, policy influencers must stand with science and act with one voice. In Lagos, Hingino John Adams, NTA News.
And to discuss further on this year's World Health Day themed Together for Health, Stand with Science in Nigerian context, I have with me Akinshola Tolu, a social worker and healthcare giver at underserved communities. You're welcome to Panorama.
Thank you very much. Pleasure to be here.
Yes. So can you please provide a link between science and healthcare looking at the Nigerian context?
All right. So science is actually the bedrock of modality. And there is nothing that we have around us now that is called modernization that doesn't take effect or take roots from science vis-a-vis healthcare. The effect of science on healthcare is that it helps in fast and easy diagnosis. Thanks for institutes like NIMA, the Nigerian Institute of Medical Research, and CDC, Center for Disease Control. They are able to, from these people, we're able to see the effect of science on medicine because it helps in quick diagnosis, in drug prescription, and helps on how to quickly attend to patients who are in need, even in the vulnerable locations across Nigeria. So we cannot rule out the effect of science on healthcare.
Okay. Now, there is a push for scientific validation of traditional and plant-based medicine. As someone on the field, taking Medicare to underserved communities, how effective would the adoption of traditional and plant-based medicine be?
From my personal experience, I discovered that more than 80% of people globally live on herbal medicine. The challenge in our context is the fact that most of herbal medicine in Nigeria are not regulated. I used to remember when I was growing up, when I get sick, my mother would go and buy dogoyaro leaf and all that and say they are giving medicine for malaria or for typhoid. But the effect is that it is not regulated, the dosage is not controlled, and it affects, at the long run, the desired result is not achieved because it is not controlled, because the dosage is not prescribed, is not regulated. So I would advocate for it to be adopted, but should be regulated, should be controlled by agencies such as NAFDAC. That will give the validation that is needed, and the desired result can also be achieved.
Okay. Diagnostic programs such as digital health technologies and telemedicine are not available for people at the grassroots yet. How can we bridge this gap?
All right. When we say it's not available yet, I don't think it is not because it's not available yet. I think that we have not really educated people. The education and the training is not effectively done for the people at the grassroots to understand how to use these things. Let me give you an example. I know of a particular location, even in Lagos, Island, where there's no hospital, there's no school, but people can access health care with the use of phone, with the use of their WhatsApp. These little technologies that we have around us can be an effective tool for proper telemedicine to reach out to the unserved location. But there's a need for training. There's a need for enlightenment. There's a need for people like you. Thank God for what you are doing, informing the world about health. So people will need to go out there and tell others that you can access health care, not necessarily when you're in the hospital. You can send WhatsApp messages. You can access through call and so on and so forth. So we can bridge gap by educating the masses.
Okay. So can you tell us, how can telemedicine work in the grassroots? What do we need to do?
All right. Like I said, we need to educate. We need to talk. Advocacy is very important. Not so many people know that they can call their doctor. They can send a message for consultation. The doctor can give a prescription via WhatsApp or via messages. So advocacy is very important. Training is very important. One of the things I do from where I work is that all of our staffs had to know how to use gadgets so that when we are not where we are supposed to be and somebody needs our assistance, they can always call us via phone. And we can talk and consult together and then make prescriptions. So advocacy and training is the way to go so that telemedicine can go deep to the grassroots and everybody can benefit from it.
Now, inability to access data-driven decision-making in healthcare for medical practitioners is still a challenge. How can this be mitigated?
All right. While I was researching on this a few months back, I saw that one of the major challenges that we have with regards to data is that people like me who are social workers, who are at the forefront, are at the grassroots level, don't give feedback to the people that need to hear it. And we need to give feedback. So every social worker, everybody who is working on the field, the reason why we need data is not just reports. It's not just because you want to give report back. Your data that you are delivering is supposed to be a tool for daily clinical decision. So if a doctor is going to give a right prescription, a right a decision is about to be taken about a particular location, maybe there's an outbreak of Ebola, outbreak of any form of disease, proper real-time data will help to achieve a good result. Unfortunately, most people at the front line don't do that. So my plea with most of us who are at the front line, who are at the grassroots, is that we must be data-driven. We must submit data to the appropriate authority that will be able to take informed decision that will help the life of every Nigerian to access quality health care.
Well, we are in the age of artificial intelligence, and it will definitely move into public health. What can Nigeria do to be more able to absorb it comfortably with little disruption in healthcare?
All right, so the first thing our government should do is to introduce artificial intelligence at every tier of our healthcare system. It is not supposed to be a system that will replace, but it should be a tool for the future. So as the government is deliberately educating our social worker, our health workers on the use of AI. Okay, I was talking to somebody, a nurse, a chief matron, and she was shocked when she asked me a question, what is ChatGPT? I was like, at this age and time. So it means that most people still don't have the knowledge that these things have come to stay, and we need to gradually grow into it. So there's a need for the government to begin to sensitize and train us. Let people who are at the front, who are at the field, maybe various government hospitals take a crash course on these things so that they can improve on these skills, so that they can learn, and let them also know. I see resistance in learning about AI, because I see a lot of people thinking that this AI is coming to take away my job. No, this AI is supposed to be a tool for you to grow. It's supposed to make your work easy and make it faster. So the earlier the people in healthcare understand it, the better, and they will be able to accept it and work with it. So it has come to stay. We need to grow into it as a nation and as an individual. And the government can help us by creating avenues for us to learn. Thank you.
Thank you so much for your time, Tolu.
My pleasure. Thank you for having me.
Away from that, cervical cancer remains one of the leading causes of cancer-related deaths among women worldwide. And at the center of it is the human papilloma virus, commonly known as HPV. Deborah Adefa in this special report examines how this infection can silently develop into cancer and why prevention remains the strongest line of defense. Her report is here presented.
Data by the World Health Organization WHO revealed that cervical cancer is the second most common cancer among women in Nigeria. The figures are worrisome, with health authorities reporting about 33 new cases and 22 deaths daily. This underscores a serious public health challenge despite the disease being largely preventable. Experts say while most human papilloma virus HPV infections clear naturally, certain high-risk strains can persist and gradually lead to cervical cancer.
There are other things that we feel we are associated with infection. Some of them we are people who have genital warts, people that were HIV positive, and then abnormal discharge. And very important, people that have pneumococcal happening.
Once a woman has bleeding after sex, they should not assume that it's normal. You go to hospital, let health workers to screen you, everything is fine.
Health experts emphasize that for women who are older or unvaccinated, regular cervical screening remains critical for early detection, which significantly improves survival rates.
So there's something in the data set in place. We call it 90-70-90. 90-70-90. Meaning that 90% of girls to be vaccinated by their age 15. 70% of women to be screened by a high performance test by the age of 35. And 90% of those who have identified as having cervical cancer should receive treatment.
Public health advocates urge parents to vaccinate eligible children against HPV, while women are encouraged to undergo routine screening as prevention remains the strongest defense.
Olumide Eguntola is standing by.